We see folks dying from preventable disease because their race, their gender, their immigration status creates discriminatory conditions that ultimately affect their health.
The goal is to really ensure the right to health for all individuals who demand it and need it, and is a fundamental human right that they have it.
Having access to a department like ours, where people are actively doing that research and pushing for that change at the highest levels of government, is absolutely critical to improving the health status of people everywhere.
The Heilbrunn Department of Population and Family Health was founded by Alan Rosenfield in 1975. The department has a really edgy history of pushing the field on science around access to sexual and reproductive health, ending maternal mortality. Over the years, that expanded. The department works on all the most complicated issues that we're facing in terms of people's health in the world. Many of our faculty are frontline physicians driving the research agendas in those areas. We see ourselves as partnering with the community to make change and improve health outcomes in the world and in the emergency room.
When we think about the major health disparities, not only in the US, but globally, one of the biggest factors is really just an underinvestment and an underappreciation of basic public health. In the light of the COVID pandemic, we've seen populations already marginalized and vulnerable by years of underinvestment in public health and difficulty with disparities of access to care who have been disproportionately impacted by this pandemic. My research and the research of many other people in our department is trying to highlight those risks, trying to help raise that voice and advocate for those populations that may not have the means to do so themselves.
The program on forced migration and health was set up about 20 years ago to train cutting-edge, informed public health workers who can deploy in humanitarian and complex emergency settings and really deliver the best in terms of public health interventions. I'm inspired by the narratives that I hear from refugees and displaced populations, the resilience that I see, the fact that they will do anything to recover their lives and to help their communities rebuild, even as they experience some of the most difficult and traumatic episodes that anyone can imagine. The science is critical to inform and empower communities who want to improve their healthcare and their living conditions. But I think it's also critical to improving practice and showing policymakers, healthcare workers, and others how they can improve the system.
The AMDD, Averting Maternal Death and Disability Program, is now both global, but also right here in the United States. The United States is one of only 2 or 3 countries in the entire world where the maternal mortality rate is actually going up. We have worked on expanding the availability, the access, the quality, and the use of emergency obstetric care. As a department, I think we've shown what can happen when you bring a justice lens or a human rights lens to public health work.
My area of expertise is working with adolescent and young adult males. And from a public health perspective, they are usually left out of the equation. We are engaging in research that highlights the importance of engaging young men across the globe in healthcare, but also in understanding the concept of male responsibility for pregnancy prevention, as well as their sexual and reproductive health.
We have a program in the department called Global Health Justice and Governance. What we do in that program is we bring together science people, lawyers, government people who do the regulations, and we try to get some consensus on how we can move forward. The kind of multidisciplinary approach that is quite practical is something unique about this program.
In sexual and reproductive health, we see disparities along the same dimensions that you would expect in other fields. So we see racial disparities, we see disparities on the basis of migration. So the real goal is to ensure access to sexual and reproductive health and family planning and safe abortion for all populations that want to engage and use those services.
My work really focuses on taking a resiliency approach to improving health outcomes for vulnerable adolescent and young adult populations. The health disparities that we see today in sexual and reproductive health are intersectional. I really see our department as taking an anti-racist framework to be able to begin to dismantle a lot of those intersectional disparities that we see in sexual and reproductive health.
We've known for a really long time that there's been a kind of disproportionate placement of industry that really pollutes in either poor or communities of color.
Migrant workers, agricultural laborers, and farmers are exposed occupationally to a whole range of toxic chemicals. The island of Kauai is the location for many agrochemical company test fields. I was particularly honored to be able to sit with Governor Iggy and to have him understand the weight of the science and to sign a bill banning chlorpyrifos in the state of Hawaii.
The department has never been more robust, and our students have never been more enthusiastic. We'd like to see justice. We think every human being should have access to decent health care. We want to see an end to all this politicization of what should be a basic human right.